I'm Dr. Alyssa Watson.
And I'm Dr. Beth Molleson.
Thanks for joining us in the Veterinary Breakroom. These are short conversations where Dr. Beth and I chat informally about relevant topics in veterinary medicine. And today's conversation was sparked because I recently had a case in clinical practice where a dog had come to me on a long-term medication that I felt probably wasn't benefiting the dog in the way that it should be. And so I had to have kind of this difficult conversation with a client about why I wanted to take the dog off of a medication that it had been on for several years, and what we were going to do in order to move forward, for this patient's best interests. And the reason that this is always a little bit uncomfortable for me, Beth, is because I never know exactly what the conversation was with the previous veterinarian. And I always want to be sure that I am respecting my colleagues because I wasn't there when the initial, conversation or diagnosis took place. And sometimes there are absolutely things that are not in the record, but that were verbally communicated to the client, and they might not even remember that. So I kind of wanted to have this conversation to see how you approached this scenario. And then as we were talking about it, we kind of got into that larger conversation that I was just alluding to about really respecting your colleagues and, giving them the benefit of the doubt because hindsight is always, 2020. Isn't that what they say?
Yes, exactly, Alyssa. And yeah, when you brought up this topic, I mean, honestly, is there anything worse than, knowing you need to somehow tiptoe the line between telling the pet owner that their pet maybe has been misdiagnosed or mismanaged, at least, again, in your viewpoint, because there are a lot of factors that factor into a diagnosis or a management strategy. But I hate that feeling. I have been in that situation a few times, just off the top of my head. I am a self-proclaimed crazy greyhound person. And so I remember a case, probably a few cases, honestly, of a greyhound that has come in and was on, had been diagnosed as hypothyroid, and of course was on medication to manage it. And I couldn't be sure if that greyhound was actually hypothyroid, or a lot of greyhounds are misdiagnosed as hypothyroid because they tend to have lower T4s. And I bring up the fact that I'm a crazy greyhound lady because I acknowledge that that is probably the only reason that those special greyhound facts have stuck in my head. And so, trying to approach that situation with the pet owner, of course, having that respect for the veterinarian. Again, I the first one to say there have probably been things that I have missed or mismanaged that maybe have been caught by other vets. So trying to put yourself in their shoes. But it's such a tricky conversation to have with those pet owners because you want to, you're not just going to keep the pet on a medication long-term to avoid that hard conversation. That's not really an option. So trying to find that balance of how to maybe divert the management plan, yet not throw your colleagues under the bus. And I hate it. I don't know if I have any good advice per se on how to handle it, but definitely want to acknowledge that it is challenging. And something I always think about too is I feel like specialists must be in this situation a lot because, of course, as general practitioners, we just don't have that detailed knowledge. Of course, a lot of times we're sending these patients to the specialty center because we're not getting good outcomes, because maybe we have a misdiagnosis or the wrong management strategy. So maybe they would be the ones who have fine-tuned how to navigate some of those situations of talking about how to, another one that comes to mind that I know I've had several times is maybe a patient that's previously had an ultrasound done at a different general practice where you don't really know if that was someone like a radiologist or an internist or someone that is well skilled in ultrasound, and having to kind of dance the dance of explaining that, yes, your pet already had this diagnostic test, but we need to have it again because our trust maybe isn't 100%. But did you feel like this was this recent scenario? Was that your the first time that this has come up, or do you feel like this is something you've dealt with throughout your career?
Oh, yeah, no, this is something that I've dealt with through my whole career. I will tell you, the one that always sticks out to me was pretty early on in my career. It was probably within the first 5 years. And I had two dogs from the same household that were both, they were unrelated dogs, but they were
Mm-hmm.
both on phenobarbital for seizures, and they were both little dogs. Um, and I thought, gosh, how unlucky, right? Like how
Sure.
horribly unlucky that these people would have two dogs with that both needed phenobarb, that both, had seizures. And I had inherited these dogs and managed them, and I managed them on phenobarb, checking their blood levels, checking their phenobarb levels, checking their chemistries, their liver enzymes, all of that for almost 2 years, when they started having breakthrough seizures that the owner was like very, very concerned about. And we upped the dosages. And I think I even went and added a second anticonvulsant. We were like adding
Mm-hmm.
potassium bromide because that's what we had back then. And finally, I got them to send me a video of what was happening. And both of these dogs had not been seizing. They had been having episodes of reverse sneeze.
Oh no.
Yeah. And so once
Oh.
we figured it out, and again, you think about, that case stood out to me so much because I can imagine the very first time that it was explained,
Mm-hmm.
it's hard to differentiate seizure from
Oh,
other
for
things.
sure.
We have a whole step-by-step algorithm and all these things. And depending on how the client describes it, if you don't witness it yourself, that
Mm-hmm.
I could absolutely see how that could happen. And I could absolutely see how if they had one dog that they thought was having seizures, and was this, and then they had another dog do a similar, action or episode, they're like, oh, this is seizure. We've seen it with our other dog, right?
Mm-hmm.
Um, so
Yep.
so that was
Oh
one, yep,
no.
where I had to be like, let's
Oh.
back off this medicine and let's, and then we had to wean off because it was phenobarb too and all sorts of things. Um, but I've had
At
other
least you're
ones.
delivering good news in that
Yeah.
scenario, I
Yeah.
guess.
And you had said, you didn't really have particular advice, and I guess that's one thing that I always try to do. I always try to phrase things as positive as I can.
Mm-hmm.
And so I always come at it from the angle of, it's possible your animal doesn't need this medication, and so we can save the expense and the monitoring. And even though lots of medications are very, very safe, any medication has the potential to have an adverse effect. And so oftentimes I'll try to approach it that way if I have, something that you know a treatment plan or a long-term medication that I have to change. That's one piece of advice I guess I have, is to come at it from a positive angle.
Yeah, I think that's actually great advice. And I think, again, I think the cost is something that sometimes we can go back to, whereas like, yay, we're done with these phenobarb checks, and the cost of the medication. I think too, maybe saying like, maybe the case of the Greyhound or something, oh, we're one step closer to getting the pet, I don't know what it needs, or maybe one step
Mhm.
closer to finding a definitive diagnosis, or, phrasing it in that light, I think is a good way too. Cause it is, you don't want to, I also worry about, I think oftentimes there are ways to mold the conversation so that they don't realize that anything was ever done inappropriately. And I think sometimes that's an option, but I also find that to be a little tricky to navigate, because I think you still have to be honest with the client. You don't want to get into a
Mhm.
situation where you feel like you're covering up something that maybe truly wasn't great. Um, so yeah, it's just it can be hard. I like that the reverse sneezing case though. So that's really kind of entertaining. Oh my
Well,
gosh.
well, recommendations change too.
Mhm.
And so I know, things like I mean, when I first got out of school, anything that had a heart murmur was put on an Allopril, just preemptively. And those
Mm-hmm.
recommendations change over time too. And so depending on how long some people have been, monitoring these cases or having these treatments, it could have been something that was recommended even just a few years ago. And so that conversation, that obviously makes it
Mm-hmm.
a lot easier conversation to have with the client when you can say, oh, there's new studies or there's new information out. So that's another one to kind of keep in your back pocket, or I'm going to look into this because you know, I haven't used that medication this way before. Phrasing like
Right.
that.
No, I think that makes sense. And I think I like that phrasing because it's certainly not, even saying something like, oh, I recently read or recently found out that greyhounds tend to have lower thyroid levels. And, I think the question we raise is why not just throw that other vet under the bus? So I want to kind of get into that aspect you mentioned a little bit earlier too. Whereas, why is it, at least in my opinion, important to not do that? And I think some of the reasons are obvious. But to me, I just feel like so many examples of situations where somebody comes in and says, oh, my last vet told me this lump was perfectly fine and I don't need to worry about it. And I'm like, did they say that? Or did they say like, it's probably lipoma, but I think we should test it. And you
Mhm.
interpreted that as this lump is fine and I can ignore it forever. It just goes back to that game of telephone where I feel like we just really need to be careful um, what we interpret from the pet owner about what happened in any given situation with a previous vet. Because I mean, I feel like we both know people leave our exam room and have just a completely different, if you were to play a game of telephone and they were to relay the information you gave them to someone else, would it be 100% accurate or is it maybe tweaked? So again, going back to that, just really benefit of the doubt anytime we're dealing with a colleague. And I actually feel like in vet school, they did a really good job of hammering that home with us. We're like, hey, we're going to look through the records from the referring vet. We are not here to critique what they've done. We are here to take what they've done and move
Mhm.
forward. And they were really strong on respecting what that general practitioner did. But I do feel like being out in the real world, I've seen a few situations where maybe not everyone is always giving that benefit of the doubt, but I do think it's so critical.
No, absolutely. And that's you bring up a very good point too with, you take the information that you have, read the record and then you move forward from there. Okay? Because that's all you can do. All you have is what's in front of you. You weren't there for the original conversation. And I tell people that all the time. I say, I wasn't there. So I can't comment on why somebody did something. I can comment on why I do something, but I'm not going to opine about why a colleague did something. So we're just going to move forward from here.
Yeah,
So,
I think that's good phrasing too, is, saying the findings that your last vet had may have been different that day based on the physical exam. Things may have changed for your pet. Here's what I see now, and here's what we're going to do. I think that simple phrasing can sometimes be to your advantage as well.
yeah, because you are also wanting this client to trust you now to move forward with a different plan. And, that can be a challenge as well, especially if they were very attached to their previous, DVM, or and that person, retired or left the practice or something like that. We've talked about that on the podcast before, about people who, only want to see this one doctor, and how do you handle that? So, yeah, so that's something to keep in mind as well.
Yes, I think that's a good point, that there may be a personal relationship or just a respectful relationship there that really isn't our role to, get in between or have them think differently of whoever that last vet was. So, yeah, tricky. Never envy anyone who's having to address those scenarios in practice. Again, hats off to the specialists who I'm sure,
Right.
just for the fact that they get so many previous records, I know they're dealing with that a lot.
Yeah, absolutely. So, well, that kind of brings us to the end of today's conversation. Beth, do you have any wins that you want to share with us?
Oh my gosh. Yes, I can share a win. We're kind of coming off the Halloween season, going into the old Christmas season, which I'm not quite ready for. But going back to Halloween, my big win of the fall is that my 6-year-old daughter, who hates wearing costumes, she actually found a costume that she was willing to wear this Halloween. So previously she's really only worn like character pajamas and things like that. And this year she found this awesome shirt. I know this is kind of a lame one, but it's the small things for me. This awesome shirt from Amazon that had an elephant on it, and then her arm was like the trunk. So anyway, it was one of our first successful Halloweens. We have struggled on so many Halloweens past. I feel like, I don't know, Alyssa, as a mom, don't you feel like holidays are always like me screaming, like, we're going to have fun, as everyone's crying. So we just, this Halloween, everyone really had fun, and I'm going to embrace that small win.
I love that. And that is not a small win. That is a huge win. I think so much time and energy and effort goes into planning holidays and family get-togethers. And I think a lot of it is behind the scenes. And that was something that when I became an adult, I finally figured out that this stuff just didn't just magically happen, that my mom had to create it all.
Yeah.
And so yeah. So no, that's an awesome win. I love Halloween. So we always do matching costumes and everything. And so we did that. But my win this month is actually, I had a very good friend that I went to vet school. He and his wife came and visited, and we attended U2 at the Sphere here in Las Vegas. So this is a new venue in Las Vegas. It's apparently the largest spherical building in the world that they built. And I will have to say, it's like an IMAX on steroids. It was unreal. I can barely describe the experience, but it's ruined every other concert.
Was it like the performance was 360?
So yes, it was an amphitheater. So it only came around, kind of like an IMAX, but
Gotcha.
came all the way through your full, field of vision. And, it was just gigantic, and the stage was down at the front, at the bottom, but then they projected, images onto the screen, and it ranged from everything from, abstract dancing lights to, there was this one scene, it was so incredible. The whole dome was blue, and then this little insect flew in and kind of like landed on it like you were under a bubble under a dome, and then more and more and more and more came in, and butterflies and grasshoppers, and then suddenly it was all blacked out, and then they all flew away at the same time, and then you could see the Las Vegas skyline behind you, and it just like matched the music, and U2 is like incredible. I had never seen U2 in concert before, and it was everything that I imagined that it would be. U2 was fantastic. So if you ever get to go to Las Vegas and see a show or something at the Sphere, I encourage you to do it because it's incredible.
I was gonna say, that sounds awesome. Only in Vegas. That's wonderful.
Yeah.
And your friends made it safely.
Yeah.
Soundly.
My friends made it. Yep.
That's great.
We got to tell some old vet school stories, so that was fun too.
It's wonderful. It's another big win.
Well, thank you, Beth, for sitting down with me again today. And thanks to our audience for joining us in the Veterinary Breakroom. We'll see you next time. Thanks for listening to today's episode of Veterinary Breakroom. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts. Or drop us a line at podcasts@vetmedics.com. Veterinary Breakroom is a VetMedics production, produced by Alexis Ussery and co-hosted by me, Dr. Alyssa Watson, and Dr. Beth Molleson.